Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. We upload new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time, so please consider subscribing. Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our video today. Apologies for not posting some videos in the last week and a half. We had a bit of a family emergency. I had to take some emergency leave, but we're back in work today. So what we have here is a compilation of two different patients. So this first patient has a buildup of very dry skin, and what you saw in the last shot there was that the skin's actually grown up from the canal walls up into the canal, so it's kind of blocking the ear canal off a little bit. So what we're doing here is using the standard size Zollner tube just to probe the front end of this kind of very thin skin layer to try and lift it from the canal wall if we can. Sometimes if you lift from the base here, you can get a grip underneath it with crocodile forceps and take the whole thing out. You can just start to see a little bit of a lift and peel there. Just switching to the fine ends now, because sometimes you can get a better lift with a much more delicate end on there. Try not to press too hard into the canal walls. Just looking for any kind of flex there at all in this dry skin. What you'll see though is as we press on this left side, see the right side is starting to flex there. So it shows me that the whole thing is one piece of skin. So we're looking for any purchase on this skin. There we are. See it just starting to peel away there. Trying to get a grip on some of the edges here. Looking for where this skin starts, because it starts quite far out from the canal by the looks of it. There, you can just see the top. There we go. So as we get a grip on that top layer there, can you see everything now starting to peel away? Now we've got a good gap there. We're going to go in with a crocodile forceps just to try and take this away. Unfortunately, we didn't get it all in one piece. You can see just broke the end off, but we'll go in and get the remainder from the canal walls there. As we pull, there you go. You can see the whole thing comes away. Maybe take a look in there again. There's the eardrum. So this is what we moved. This is that skin layer. So you can see it's only about 1 centimetre across, but bear in mind, the ear canal is quite small. So what, half an inch there. So this is our second patient. This is much more the kind of standard stuff we do here. So this is more the earwax removal side of things. So you can see it's just quite soft there. So we're just going to use the standard size Zollner tube here just to probe the outside of this wax. See, it's quite crumbly on the outside, so a little bit's just breaking away. So the Jobson horn comes into play here. Trying to get behind it. You can see there's a little bit of dry skin at the Jobson horn, just trying to push through there just to get behind this bit of wax. Switching back to the suction tube now just to clear up. So obviously when we use the Jobson, we push down into the wax. It can sometimes kind of spread the wax or break quite a few pieces off. So we go back in then with the standard size Zollner tube just to suction all these little bits and pieces off the canal walls. If you are enjoying the videos, guys, and if you don't mind liking, sharing, if you're not subscribed already, have a think about subscribing. So just grabbing the little bit of wax here. We've got a good grip. We can see we're able to get a little bit of movement, a little bit of a wiggle to this wax now. You can see it just doesn't want to budge very well there. Quite a home in this ear canal, this piece of wax. Thank you very much for all the lovely messages you guys sent me when I disappeared for a week and a half as well. They were appreciated. I did read them all, so thank you very much. There you go. You can put a little bit of olive oil in here now, just to help us get a good grip on this harder section of wax and to lubricate the canal wall. So we're hoping, whereas this has been quite firmly wedged in there, by using the olive oil, we can hopefully get a good grip and just wiggle up and down just to get a bit of movement there. Now you can see it's starting to come away now. Perfect. Out he comes. Whoops, just fell off at the end. And there's the eardrum there, all looking nice and shiny. Very similar story on the other side here. So you can see that we've got some dry, it looks very crumbly like the other side. See, it's actually quite solid. Just starting to get a few little bits and pieces breaking off there. Difficult this one because it's quite a narrow taper to the wax at the front end here, so you can't really get the good suction grip that you'd normally need to take this away because that taper's there. So I'm just trying to break the taper away just so I can get to the a more flatter surface behind there to get a good suction grip here. There we go. It's the first piece gone. So we'll just see what's left behind it there now. There's a bit more in there. Just lifting from the base and trying to unstick as we did with the other side. Just getting a bit more of a wiggle to it now. Little bit of movement to this wax. On its way. It's like the other side, it's very at home in here, it doesn't want to budge. Just move it left, right to guide it. Remember, there are bends in the ear canal, so we do have to guide it around a bend. Sometimes the wax will form on a bend, so you imagine trying to get a slightly curved piece of wax through a straight end. You've got to kind of guide it around the curve first before you can get it out. Because I've got a nice solid piece, so I really want to go in with a Jobson horn if I can help it here. I'd rather use it as a last resort if we have to, just because it will push down in this wax and break this chunk off. Well, if this is formed on a bend, it's going to be more difficult to get a good suction grip on it then for the next section. But you can see it is just starting to come away. There we go. Now we're starting to get a bit of movement to it. It's starting to roll down the canal. It's getting there. There you go. And out he comes. You can see a little bit of white dead skin at the bottom of that piece of wax there that came away. And it all came away in a nice one big piece. So you can see lovely shiny eardrum there. So this is what we removed from this patient. You can see there's quite a bit in there, but up to an inch worth of wax between both ears. And thanks for watching again, guys, and I will see you again on Friday.
Thank you very much for watching our video today. If you did enjoy the video, then please like. If you're not subscribed already and you'd like to do so, you can click the subscribe button here. If you'd like to check out some more of our videos, they're also up there. Now, if you want to follow us, you can do on Facebook, Twitter, Instagram, and also check our website if you want to know a little bit more about us. As always, guys, until the next time, take care.